Hi, my name is Michelle Aiello, and the disease I chose is multiple sclerosis. What is multiple sclerosis? Multiple sclerosis is a progressive degenerative disease. In multiple sclerosis, neurons of the brain, spinal cord, and cranial nerves progressively lose their myelin. The effects, severity, and progression of MS vary considerably from individual to individual and is characterized by remissions and exacerbations. In the affected fiber, myelin loss interferes with conduction of impulses. Affected nerve fibers occur in diffuse patches throughout the nervous system. There is research that suggests cognitive function can be impaired, especially with regard to attention and memory. Earliest lesions result from an inflammatory response and cause cells that normally do not enter the brain or spinal cord to attack neurons, resulting in loss of myelin in the white matter of the brain or spinal cord. A protein in the blood's clotting mechanism has been identified as a trigger for the inflammatory response. As the disease progresses, plaques or larger areas of inflammation and demyelination become more visible. The plaques are commonly found in the lateral ventricles of the brain, in the brainstem, and in the optic nerve. Initially, the area of plaque appears pinkish and edematous, but then becomes gray and firm. Each plaque varies in size, and several may come together into a single patch. A short period of reduced inflammation and normal neural function may be experienced before an exacerbation occurs again. With time, neural degeneration becomes irreversible and function is permanently lost. With every new occurrence, additional parts of the CNS are affected. MS varies in severity and progresses at different rates. What causes MS? In most cases, symptoms begin between the ages of 20 and 40, peaking at 30 years of age. Women are more likely than men to develop this disease by a ratio of 2 to 1. There is no known cause for the disease. MS is believed to be an autoimmune disease with genetic, immunological, and environmental components. MS is more prevalent among people of European descent, and close relatives of people with MS are at increased risk. What are signs and symptoms of MS? The signs and symptoms of MS are determined by the areas that are demyelinated. Common signs and symptoms are blurred vision, weakness in legs, double vision, blind spot, and partial loss of vision, slurred speech, numbness, burning, and tingling, progressive weakness and paralysis extending to the upper limbs, loss of coordination, bladder function, bowel and sexual dysfunction, and chronic fatigue. Depression and euphoria may develop later in the course of the disease. As the disease progresses, immobility-related complications such as respiratory infection, pressure ulcers, and contractures may occur. How is MS diagnosed? There is no definitive test to diagnose MS, and a long delay may precede diagnosis. However, there are a number of different tests and analyses that can be conducted to help in determining a diagnosis of MS. An initial diagnosis is often based on a history of exacerbations and remissions, involvement of multiple focal areas, progressive nature, and absence of other neurological diagnostic criteria. MRIs are used to diagnose and monitor patients. CNS lesions are detected with MRIs. Cerebrospinal fluid can be tested for elevated levels of protein, gamma globulin, and lymphocytes. In a visual evoked potential test, the brain is stimulated by specific sensory pathways in order to measure activity and detect the impairing of conduction caused by demyelination. How is MS treated? There is no definitive treatment approved for MS at this time. There are treatments that can help relieve the signs and symptoms. Physical and occupational therapy, muscle relaxers, avoiding excessive fatigue, stress, injury, and infection can help reduce the number of exacerbations. Working with a speech and language pathologist can help maximize communication and assist in feeding problems. What is the prognosis of MS? Different types of MS have different prognoses. Each case is unique. People with MS live about 5 to 10 years less than people without MS on average, but as treatment and care continue to improve, that gap is shrinking. Most people with MS have a life expectancy close to normal, and it's not a fatal illness in most cases. Complications of MS. MS complications are different than symptoms. Complications are problems that arise from MS symptoms. Some of those complications are urinary tract infection due to urinary incontinence, osteoporosis due to lack of weight-bearing exercises, pressure sores due to sitting or laying for a prolonged period of time, aspiration pneumonia due to difficulty swallowing, and depression due to the stress of having a chronic disease. Follow-up care is recommended at least once a year. Patients receiving medication should be monitored at least every 3 to 4 months. Patients with severe symptoms or who lack support from family and friends may require more frequent visits. Can MS be prevented? Multiple sclerosis is a chronic condition with no cure. It cannot be totally prevented either. There are some risk factors that cannot be modified, like your age, genetics, and gender. However, there are some risk factors that you can change to help reduce the risk of developing MS. Those are called modifiable risk factors, and they include your diet, geography, lifestyle, gut health, and infections. The deficiency of vitamin D increases your risk of developing MS. You are more likely to develop MS if you live farther north or south of the equator. Obesity and smoking are also risk factors. Studies have strongly shown that previous infections increase a person's chances of developing MS as well. Thank you. That concludes my presentation on MS. I hope you enjoyed it.